Welcome to the Medication Administration via Gastrostomy Tube Recertification Module for Wall Residences. My name is Jessa Lane, the Medical Quality Assurance Coordinator, and I'm going to guide you through this refresher module. The purpose of this module is to maintain compliance with the Virginia Drug Control Act, maintain compliance with DBHDS regulations, review theory related to medication administration, and review the correct and safe procedures for medication administration via gastrostomy tubes. Maintaining certification. According to DBHDS regulations, in order for a medication aid to maintain G-tube certification, a medication aid must 1. Attend a semi-annual or twice-a-year refresher course with module. Successful completion of this video module with successful completion of the accompanying test will suffice as your refresher module. Additionally, medication aids must perform a semi-annual skill competency checkoff with a registered nurse. Medication aids have 30 days after their certification expires to meet recertification requirements. During this time period, the medication aid cannot administer medications or perform other G-tube related tasks. After 60 days, certification lapses and initial training and competency requirements must be repeated. Medication aids are required to complete this refresher course before certification expires or lapses. Purpose of percutaneous gastrostomy tubes or G-tubes. The gastrostomy tube is a temporary or permanent means of feeding an individual when the normal passage of food into the stomach is altered by a physical blockage or the swallowing process is impaired. This means that an individual is not able to safely take in adequate food or liquids by mouth to sustain normal growth and development. Neurological conditions may warrant an individual requiring a G-tube. Please take a moment to review this slide. Components of a G-tube or parts of a G-tube. There are four main components of most G-tubes. The feeding adapter connects the G-tube to the feeding administration set. The balloon inflation port is used to inflate the balloon that secures the tube in place internally. The double lumen adapter is used to connect a G-tube to a J-tube. One port is used for nutrition, another port is used for medication. Please note that not all G-tubes have two ports. A bolster is a plastic disc that secures the tube in place externally. Description of G-tubes. We're going to talk about basic, low profile, balloon types, and non-balloon types. A basic gastrostomy tube is a catheter that's made of rubber, latex, or silicone and comes in a variety of sizes. A deflated balloon is located at the end of the tube that is inserted into the stoma. Once inserted, the balloon is inflated to prevent the G-tube from coming out. An anchor is threaded into the tube prior to insertion to prevent migration of the tube and to minimize tube movement. Low-profile gastrostomy tubes are made of silicone. There is an inflated balloon at one end and a flip-top cap on the other end. The tube lies flat against the abdomen of the person. Tubing is attached to a low-profile gastrostomy tube when the individual is fed or is to receive medications. The size and circumference will be labeled on the tube. Non-balloon types are generally inserted and removed by physicians, and they require mild sedation and endoscopic techniques to ensure proper placement. They can be long or low profile and last between 2 to 5 years. Balloon types. The Mickey Key profile button is a great example of a low-profile balloon type G-tube. Generally, they have a water-filled internal balloon to prevent the tube from coming out. They can be replaced by trained registered nurses and last 6 months to 1 year. Infection control, hand hygiene, equipment care, and cleaning. Always use proper hand hygiene before and after any care of a G-tube. You can use a hand sanitizer so long as it's alcohol-based, or you can simply wash your hands with soap and water. You will always wear gloves when providing any care of a G-tube. You will always use proper hand hygiene after removing gloves, as well as to change your gloves between each individual. Care of equipment. All equipment should be cleaned immediately after use. Mild soap and water can be used to clean equipment. Gravity bags should be filled with water and allowed to drain to ensure the bag and tube are clean. IV poles and pumps should be wiped down after each use. Syringes and extension tubes should be changed weekly or sooner and allowed to air dry. Cleaning equipment. Wash the syringe and canister with warm soapy water and allow to air dry. Cover equipment with a paper towel or a clean cloth and place in the individual's bin. Syringes may be put back in their original container and labeled with the individual's first and last name, the date the syringe was opened, and the initials of the staff person who opened the equipment. Syringes and extension tubes should be changed weekly or more often. Medication cups, however, cannot be reused and should be changed with each administration. Stoma inspection and stoma care. A stoma is a surgical opening into the stomach where the G-tube is inserted. Skin around the stoma site should be cleaned daily with soap and water and dried thoroughly. Skin protecting ointment may be ordered by the physician. If a dressing is needed to protect skin around the stoma, change the dressing daily and PRN. Do not place tape directly on someone's skin. Place tape on the dressing only. The use of skin prep may be necessary. If granulation develops around the stoma site, staff should monitor and notify healthcare professionals for directions on care. Medications may be administered even if granulation is present. Gauze or G-tube bumpers can be used to protect the skin around the stoma site. If skin around the stoma site becomes swollen, red, warm to the touch, and painful, the staff should seek medical attention immediately, as these could be signs of an infection. Physician orders for medications. Please remember to adhere to the 6 rights of medication administration. They are on the screen in front of you for your review. Right person, right medication, right dose, right time, right route, which in this case would be via a G-tube, and right documentation. Other physician orders needed within services that support individuals with the G-tube would include 1. An order for right positioning, such as sitting, standing, both, etc., when someone is to receive medications or feedings. You'll also need an order to crush medications. This is required as all medications must be crushed in order to be administered via a G-tube. You'll also need an order for a safe residual amount. Please remember that this needs to be specific: 150 milliliters, 100 milliliters, etc. Medication administration considerations and other medication-related guidelines. Tablet medications are powder medications that are condensed and pressed to form tablets. They will dissolve in the mouth, esophagus, and stomach if taken orally. Tablet medications are easily crushed and dissolved for G-tube administration. Enteric-coated medications are medications that are kept from being activated in the mouth, esophagus, and stomach if taken orally. This coating is not readily dissolvable, which is why crushing these medications is not desired. Capsule medications are used to package medications that are fine powders or pellets that cannot be turned into a tablet. The capsule will dissolve in the stomach if taken orally. The contents of the capsule can be removed and mixed with warm water for G-tube administration. There is no need to crush the pellets within the capsule. Gelatin capsules are used to house small amounts of liquid medications. They generally dissolve in the stomach and small intestines if taken orally. Punch a pinhole in the capsule, squeeze out the contents, and mix with warm water for G-tube administration. Other dosage forms for G-tube medication administration. Liquid preparations should always be administered with the proper dilution. Administer immediate release capsules after crushing and mixing with warm water. Crushing medications. Remember, there must be a physician ordered to crush medications. Unless ordered by a physician, do not crush enteric-coated, sustained release, enzyme-specific, buccal, or sublingual tablets and capsules. Sustained release medications are designed to deliver a dose of medication over an extended period of time. Generally, they are denoted by the following suffixes. Please take a moment to review. Other considerations continued. Bulk-forming laxatives such as Metamucil are not to be administered through feeding tubes unless specifically ordered by a physician. Bulk-forming laxatives tend to form a solid mass that may occlude or block a G-tube. Enteral nutrition and medications. Enteral nutritional feedings may alter the bioavailability of some medications. Do not add medications to an enteral nutritional feeding formula or to an empty nutritional container unless ordered by a physician. Some medications are considered physically incompatible with enteral nutrition formulas because they may precipitate and clog the tube. Crushed ibuprofen, ferrous sulfate, and aluminum hydroxide are examples. Technique to verify placement of a G-tube or check residuals. The following slides will provide step-by-step instructions on how to properly verify placement and check residuals. You're going to start by opening the G-tube port. Air may escape when you open the G-tube port, so watch out for gastric contents. You're going to connect a 60 milliliter syringe to the G-tube port and gently aspirate or pull back on the plunger. This will create a suction that allows for the flow of gastric contents from the intestinal tract into the syringe. Aspirate until there is no longer any fluid entering the syringe. This is the residual amount of fluid. Pay attention to what this fluid looks like, how thick or thin it is, and note any other abnormalities. Gently return the residual amount of fluid back into the intestinal tract. If the residual amount is 100 milliliters or more, unless otherwise ordered by a physician, do not return the residual amount and call the physician. Positioning. After verifying proper tube placement, positioning the individual is the most important factor to prevent complications. Instructions for correct positioning come from the physician's orders and must be followed at all times. Many individuals remain in the prescribed position for up to 2 hours after receiving medications in order to prevent complications such as reflux and aspiration. Positioning an individual in an elevated position of 30 to 45 degrees in bed or in an upright position in a chair increases the movement of gastric contents from the stomach to the intestines. Individuals should never be placed in a flat position unless ordered by the physician for feedings or medication administration, as this will increase the chances of reflux and aspiration. Some physicians may order that an individual be placed on their right side with their head of bed elevated to promote stomach emptying. Again, always refer to physician orders for guidance on safe and proper positioning for feedings and medication administration. Medication administration procedure with step-by-step instructions. Prior to medication administration, please ensure that you've identified the appropriate person. If an individual is receiving continuous feedings, please stop feedings for 1 to 2 hours prior to medication administration if the medicine is associated with incompatibility with the nutritional formula. Also, turn off feedings for 30 minutes if medication should be administered on an empty stomach. You're going to need to clear the tubing of any residual and check for patency of tube while flushing with the 30 milliliters of warm tap water. Warm water should flow freely without using the plunger. Supplies and equipment necessary for medication administration include medication, a 60 milliliter syringe, pill crusher or mortar and pestle, warm tap water for dissolving medications, and warm tap water for flushing the G-tube. You'll need enough water for a pre-administration flush, a post-administration flush, and during administration flushes. You also may need a clamp and gloves. Crush immediate release tablets into fine powder and dissolve in warm water. Open immediate release capsules and dissolve in warm water. Dilute liquid medications with warm water. Punch holes in gelatin capsules to empty the contents into warm water. Do not crush sustained release capsules or enteric-coated capsules unless ordered by the physician. Establish privacy for the individual, explain the procedure, position the individual for safe administration, check for proper tube placement by aspirating stomach contents, which we covered earlier, return the residual contents. You're going to disconnect the syringe from the G-tube, clamp the G-tube, remove the plunger from the syringe, and then reconnect the syringe without the plunger to the G-tube. Flush the G-tube with the prescribed amount of warm tap water. Allow gravity to flush the tube if possible. Clamp the tube after the syringe is empty and allow the water to remain in the G-tube. Pour dissolved and diluted medications into the syringe. Unclamp the G-tube and allow gravity to administer medications. If administering more than one medication, flush the G-tube with 5 milliliters of water between each medication. If administering more than one medication, administer liquid medications first and then dissolved medications. After medications have been administered, flush the G-tube with the prescribed amount of water. Clamp the G-tube, remove the syringe, reinsert the G-tube plug, unclamp the G-tube, and then keep the individual in an upright position for a minimum of 30 minutes. Documentation of medication administration will always occur on the Medication Administration Record, or the MAR. You'll also need to document that tube placement was checked. You'll need to document the residual amount if there was one. Notify healthcare professional if the residual amount is more than 100 or as amount otherwise prescribed by the physician. You'll need to document the individual's response to the procedure or if they refuse the procedure. Venting a G-tube, the purpose and the procedure. If an individual's stomach becomes hard and swollen after feedings, venting or burping the tube may help. This may be done before feedings or intermittently between feedings, or if you note excess air or gas in the stomach. To vent the G-tube, you must wash your hands, gather your supplies, which includes water, a syringe, and gloves, position the person in 30 to 45 degree upright angle, provide privacy, put on gloves, and expose the G-tube. You're going to clamp the G-tube and attach the 60 milliliter syringe in order to check residuals. If the residual amount is less than 100, you're going to return the residual amount. If it's more than 100, you're going to call a healthcare professional. You're going to clamp the tube and then remove the syringe. You'll remove the plunger from the syringe and then reattach the syringe to the G-tube. You'll pour 30 milliliters of water into the syringe and you'll hold the syringe lower than the stomach so the water does not enter the G-tube. That's important. You'll also want to hold the syringe pointed away from the individual and away from you. You'll then unclamp so that the air can escape for 1 to 5 minutes or as prescribed. After venting, you'll allow the water to enter the G-tube in order to flush the tube out. You'll then reclamp the G-tube and close off the port, clean up your supplies, wash your hands, and then document the procedure. Tube replacement and accidental removal. A replacement tube should always be available for each individual. Medical professionals will evaluate the need for G-tube replacement. G-tubes that are not functioning properly will be changed by licensed medical professionals. Accidental tube removal. You'll cleanse the area with soap and water, then cover the stoma with a clean, dry gauze to prevent drainage of gastric contents. You'll notify medical personnel immediately. You'll transport the individual to the emergency room or other facility. Be sure to take the replacement tube with you to the emergency room or the alternate facility. Complications and interventions. Reasons to contact medical personnel. Feedings that are not being tolerated. Symptoms would include diarrhea, a stomach that's hard and swollen, vomiting, and cramping. If you note any signs of infection around the stoma, which includes redness, swelling, and drainage. If you see any signs of tube migration, which include an obvious shortening of the tube, intestinal cramping, retching, or vomiting. If the G-tube is blocked and preventing the flow of fluids, or if you note any other abnormal findings or concerns, such as coffee ground material noted in gastric content or the tube completely dislodges. If the stomach contents from the gastrostomy tube or the stoma have drained onto a person's skin, the fluid can irritate the skin. The affected area should be cleansed thoroughly with soap and water and allowed to dry. The longer the fluids are in contact with the skin, the greater the irritation can be. Please report any irritation to a healthcare professional. Congratulations, you've just completed the Medication Administration via Gastrostomy Tube Refresher Module for Wall Residences. Your next steps will be to review the PDF entitled Potential Problems or Complications found below this video. You'll need to take the test located below this video and hit the Submit button when you're done. Perform a skill competency checkoff with a registered nurse before your certification expires, and send proof of those competencies to Michelle Morris at the Wall Residence's main office in Floyd, Virginia. If you have any questions, feel free to contact your program manager, your regional coordinator, or myself. My contact information is on the screen in front of you. Thank you so much for your attention during this refresher module. Don't forget to take the written test found below this video, and also don't forget to submit your skill competency checkoffs with the registered nurse to Michelle Morris at the main office. Again, thank you so much for your time and attention, and I hope you have a wonderful day.